So your medical and dental expenses include your actual medical and dental expenses, and that's defined as amounts you pay for the diagnosis, cure, mitigation, treatment, or prevention of disease, or for the purpose of affecting any structure or function of the body. That will also include transportation, qualified long-term care services, and insurance that is primarily intended to cover medical care. So specifically, we'll be including insurance premiums for medical care. So insurance for your car, even though it will pay some medical expenses, is not primarily intended for medical care. So vehicle insurance is not a medical expense. Supplemental insurance like Aflac is also not a medical expense, even though it will pay you if you are hospitalized or something like that. But the intention is not to pay for your medical care. The intention is to as replacement income for when you're not able to work. Yeah, Nick.
Good in that field. The taxes or the benefits that are pre-tax, they are taxable deductible to the business, but the benefits from like the payout from, is that taxable?
Yes. So those payoffs that you get are taxable or not, depending on whether the payments that were made into it were pre-tax or post-tax. So, for example, if you picked up short-term disability insurance and you decided to make that a post-tax payroll deduction, then your short-term disability payments are non-taxable. But if it's a pre-tax payroll deduction, then you're lowering your income tax, but if you do end up taking those benefits will be taxable. There's an entire list of stuff that can be and might not be deductible. We're not going to go into all of the entire list, but it's helpful to have this available to refer to if you're doing someone's taxes. After you've added up all of your medical expenses, then you have to reduce your medical expenses by 7.5% of your adjusted gross income. So basically, when we're doing a client intake, we say, do you have major medical issues? Like if you go to the doctor for an annual checkup and it costs you $500, that's going to be less than your 7.5%. And so it's not going to figure into your taxes at all. But if you had multiple surgeries and your expenses might come out to $80,000 or $100,000 out of pocket, then you probably are going to have a medical expense deduction on your Schedule A.
So going back to if you pay off medical for example, let's say you own your house, you take out a mortgage, pay for substantial surgery, and it's over 100% of your income. How does that work?
Then you won't be able to carry it over to a future year. So you might end up with so much medical expenses that wipes out your entire taxable income. And we actually have at least one client in that situation where he's using up his savings to pay for his long-term medical care. He's in his 90s. He has quite a bit of money in the bank, but his nursing home care is very expensive. So his income is something like $50,000 or $60,000 because of his pensions. His itemized deductions are something like $90,000 every year. So he ends up not paying any taxes, but we still have to file a tax return, and we have to see, we get to count those, and that excess is lost. That extra deduction doesn't carry over or carry back or anything. Whose medical expenses can you include? You can include your own medical expenses, obviously, and always. You can also include your spouse's medical expenses, even if you're not filing a joint return with your spouse, as long as you're the one paying them. You can count your dependents, claim their medical expenses. That should seem pretty obvious. You can also count medical expenses for anybody who was your dependent at the time the medical care was provided. So maybe your 17-year-old had oral surgery 2 years ago, and this year you finally came up with the money to pay off the bill, and they're 19 now and not your dependent, then you get to deduct that this year, even though they're not your dependent anymore. There's also, you can claim expenses for your children even if they're not your dependent. It's not on this slide, but that is true. And you can also, so this special rule is slightly confusing, but what it says is that you can claim medical expenses for anybody who would have been your dependent, except for the fact that their income is too high. Which means if we remember the rules for qualifying relative, which were what? Not a qualifying child of another taxpayer. Mm-hmm.
Yep. Member of household or relationship, right? Gross income and support.
Yeah.
And then,
let's see. And you said member of household or related and support. So for purposes of this special rule for claiming medical expenses, we ignore the gross income tax. So if they're not a qualifying child and you're supporting them and they're either related to or living with you, you can claim their medical expenses, even though they're not technically your dependent. You can claim your children's medical expenses as long as either you or the other parent can claim that child as a dependent. Okay, so here's some medical expenses that you could claim that are maybe a little bit less familiar to people or maybe not as obvious to people. You can claim the cost of your eyeglasses, contact lenses, other medical aids such as crutches or wheelchairs. If you have a medical service animal, the cost of that animal and the cost of the care and feeding of that animal is also a medical expense, as long as it is for a disease or other condition that's been diagnosed and is recommended by a doctor. So, and they don't actually have to be a service animal. So for purposes of the Americans with Disabilities Act, the only animals that can possibly be a service animal are dogs and miniature horses. Yeah. I don't know, I've never seen a miniature horse service animal, but that's what's in the actual law. But emotional support animals could also qualify if you have a specific diagnosed condition and the care and ownership of that animal will either will somehow help treat that disease or condition. Weight loss programs can be deductible if you have a disease that's been diagnosed. So if your doctor just says you need to lose some weight because it's healthier for you, that would not be deductible. But if you are been diagnosed as pre-diabetic or even just obesity is a medical condition, and your doctor says you need to lose weight and here's some things that might help you do that, then those would be deductible expenses. There is a rule, however, that Your basic personal expenses, everybody needs to eat, everybody needs to wear clothes and groom themselves and have a place to live. Your basic personal expenses are generally not deductible. So for example, if you have a celiac condition and you need to buy gluten-free, or if you have any other specific dietary condition that makes your food more expensive, you can't just deduct all the costs of your food, but you can deduct the difference between what your diet costs and what a normal person's diet costs, or a typical person.
So like for allergies and stuff too then?
Mm-hmm.
So would that include like supplements that the doctor recommends, things like that?
Yeah, unfortunately, any supplements that can be obtained without a prescription are not considered medical expenses. So even if your doctor recommends that you take a daily dose of aspirin for a heart condition, that aspirin is not deductible. Any over-the-counter medication that you can acquire without a prescription is not a medical expense. So cold medicine, anything like that. With the exception of insulin. Apparently insulin you can get without a prescription. Over-the-counter devices that you can purchase that would be medical expenses. So if it's not medication or supplements, then you can deduct other things like blood pressure monitors to help if you have hypertension. That would be part of the diagnosis and treatment of a disease. Yeah, a pulse ox monitor, a blood sugar testing kit, and you can get all of these things without a prescription. You just get them off the shelf at Walgreens or from wherever. Yep. So medical devices, even if you get them without a prescription, are deductible, and that also includes breast pumps.
But not formula.
Right. While you're seeking medical treatment, you can also deduct your lodging for yourself and up to one companion, but only if the companion is medically necessary. Which means either if you're a minor, your parent accompanying you, or an adult accompanying you would be always considered medically necessary. Or if you're an adult, if you are, slipping in and out of consciousness all day long, you probably need someone to monitor you. So that would be medically necessary. This is pretty antiquated. The lodging deduction is $50 per day, maximum. And I don't know if you can find a hotel anywhere in the country for less than $50.
Well, I do have a question on that.
Mm-hmm.
What about seeking medical treatment outside of the United States?
You can also deduct transportation expenses, which includes ambulance, even includes air ambulance, or it includes local transportation, so vehicle expenses. So if you're driving to a physical therapist twice a week, you can deduct expenses for driving to and from that physical therapy appointment. And even if that's in Anchorage. And if you are seeking the assistance of a specialist, you can deduct the airfare to maybe Seattle is the closest location you can find someone who understands your specific condition, and you have to go there. I should mention you cannot deduct any medical expenses that have been reimbursed to you or that you reasonably expect to be reimbursed. So if you have insurance and you have a $5,000 deductible and you're not responsible for any payments above that $5,000, even if you have a $50,000 surgery, your out-of-pocket is only $5,000. You get a $5,000 check. You also can't deduct anything that's beneficial to your general health. So even if your doctor says your job is contributing to your stress levels and it's going to eventually result in a heart attack, you need to take a few weeks off. And as your doctor, I'm prescribing a 2-week vacation. Unfortunately, that vacation is not a deductible medical expense.
So none of these are
None of these are deductible.
got cosmetic surgery unless medically necessary, and that actually happens when people know because we used to bring plastic surgeons in all the time because they can hide their stitches and
What if,
surgery is necessary.
what if the doctor recommends you just lay in bed and you should not do anything?
There's no expense involved there. If your doctor says you should go to this particular hospital where there's this world-class surgeon, then that is a medical expense, even if you happen to take a couple of days to enjoy the sights while you're there. However, remember that there has to be no significant element of personal pleasure, recreation, or vacation in your travel for that to be deductible. Cosmetic surgery unless medically necessary. So, an example of a medically necessary cosmetic surgery would be, for example, if you were in a fire and you had reconstructive surgery, that's technically cosmetic surgery, but it would be considered medically necessary. It would be, so if it was to restore you to the condition you were in before whatever disaster happened to you, then that would still be considered medically necessary.
Accelerated benefits from life insurance.
Accelerated benefits are not taxable because they're considered part of your death benefits. In case you don't know what that means, what Nick was talking about is, let's say you have $1 million life insurance policy, and then you are diagnosed with terminal cancer. Your doctor says you have 5 months to live. Most life insurance companies will say, okay, well, we'll pay you your $1 million now, or a portion of your $1 million now, because it's almost certain you're going to be dead within 5 months. That's called accelerated death benefits, and you get to enjoy, or at least maybe use that money to help mitigate the pain and suffering of that terminal cancer diagnosis. And that's not taxable. And it's not considered a reimbursement either, so you can still deduct those medical expenses.
Is it considered income?
No, it's not.
So even if you're on welfare, it's not considered.
Right, because
That's good.
one of the general rules is that life insurance death benefits are not taxable. That's one of the specific exceptions. And that includes accelerated death benefits.
I don't know if welfare is the same, because when I got hurt and I got paid, that was not taxable. But welfare still counted that as income.
That's it. Absolutely.
Yep.
So I got in big trouble.
Oh yeah, maybe for purposes of
It's like if
food stamps and other
Medicaid.
Yeah.
And then you get your accelerated and you longer have Medicaid.
Oh yeah, I only know the income tax rules. So for other purposes, it might be income, but for income tax purposes, it's not income.
Cool if everything aligned, right?
Cool with that?
Everything aligned.
Yeah, excellent.
So here's an example. Chico is 49 years old, and his adjusted gross income is $25,000. So really, the only thing we need to understand as far as medical expenses is that we take his $25,000 and multiply that by 7.5%, which means the first $1,875 in medical expenses for him does not count. If he goes over that, only the excess is deductible. So if he has $3,000 in medical expenses, then he has a $1,125 deduction on Schedule A. And this note is a useful note. It's a good idea to take a note of what someone's AGI is and what 7.5% of that is before asking your client about their medical expenses, because then you'll be able to say, let's say I have another client whose adjusted gross income is $75,000. We'll multiply that by 7.5%, and I'll say, are your medical expenses going to be more than $5,600? And they say, well, and they brought the whole stack of all of their prescriptions and prescription copays, and it's all $1 and $5, and there's no way that the stack of only 400 receipts is going to be more than $5,000. So those things are. And that saves you a lot of time trying to add them up, saying, oh, well, that only came out to $1,200, so it wasn't even worth the time adding it up. If you're deducting transportation expenses, you can use your actual cost of gas and oil, or you can deduct a flat. In 2023, it was 22 cents per mile. And I don't know why they split it up like this, but that's for the whole year. You can also deduct nursing home or retirement home expenses if the primary reason for being there is because of its proximity to medical care. You can also deduct the cost of home improvements if they are of a type that do not significantly increase the value of your home, or you can deduct the excess of the cost over the increase in value to your home. The best example of this would be like a stair lift, a wheelchair lift to get up the stairs. That's not generally going to increase the value of your home. If a regularly abled person bought that home, they'd probably just remove the stair lift. In fact, the home might sell for less because that's a project that they'd have to undertake, because it would just be in the way for a normally able person.
So ramps, things like that.
Yeah.
My mom is in an assisted living home in Anchorage now. She's
Mhm.
been big dialysis from where she looked after her. So that she moved for medical reasons, would that be deductible?
Yeah, not the moving expense, but the living expense there. Yeah. So the cost of living in the assisted living home would be a medical expense, because her primary reason for living there is to access to medical care. Here is someone who has been diagnosed with asthma and gets a central air conditioning, air filter and all that to reduce the dust and pollen in his home. It costs him $3,200, and he gets an appraisal before and after, or an appraiser estimates that the value of his home went up by $2,500 because of the AC unit. The difference between his cost and the increase in value is $700, so he has a $700 medical deduction. Which, even if he has itemized deductions, remember, deductions reduce your income that's subject to tax. And so when you use that final figure to compute your tax, it's going to be based on your tax rate. So if he's in the 22% tax bracket, a $700 deduction saves you, 22% is $154. The cost of getting an appraisal is going to be more than that, so it probably wouldn't even be worth it to try and deduct that AC. Insurance premiums are deductible medical expenses as long as the insurance is primarily for medical care or long-term care. Stop smoking programs are only deductible if they require a prescription.
So you said insurance premiums are deductible?
Insurance premiums are deductible if their primary purpose is to reimburse you for medical expenses.
Explain that one a little bit to me further.
Okay,
So just general medical insurance is not.
General medical insurance is deductible.
So like Blue Cross Blue Shield.
Mm-hmm. Yeah, that's deductible because its primary purpose is to pay for or reimburse you for your medical care.
So even if you're generally a healthy person, say your insurance premiums are $1,000 per month. So that's $24,000 a year, and that's deductible.
It's deductible, but that's type of insurance is often paid for by your employer. So if it's paid for by your employer, it's a deduction for your employer, but you're not going to pay taxes on that cost of insurance.
But if you did have your own insurance.
Yeah, if you did have your own insurance, that would be a deductible medical expense.
Cool.
What if it's Medicare?
Medicare, the Medicare premiums, if you have them deducted from your Social Security, or if you pay them manually, that's deductible.
Unfortunately, I actually had to sit on a medical insurance portion. They paid the employee's portion, but the family portion was like an extra $1,400 every 2 weeks.
Yeah.
And it's like, jeez.
Yeah, Cobra insurance is fairly high. And what Cobra is if you have employer-sponsored healthcare and you lose your job, you can continue on the same group plan, but it turns out that medical care, healthcare is very expensive. You can also see this in code DD on someone's W-2 is the employer's cost of healthcare for that person. It's not relevant in any way to their taxes. It used to be, but it's not now. Before 2014, it was relevant to people's taxes, but it's not now.
And if you don't have insurance and you're just paying out of pocket every time you meet the doctor, that's
That's all.
okay.
That's all deductible. Okay. So if you're like self-insuring and you just have money in the bank and you hope that you won't need to see the doctor, but then you end up going, and you have a CT scan and some other tests, and you end up spending $30,000. Well, that's all deductible.
In the health savings account.
Health savings account
It's kind of like putting money away that your employer puts to say.
Well, health savings account is actually pretty nice. Before you can have a health savings account, you have to qualify for it by having something called a high deductible health plan. So if you don't have insurance, you can't have a health savings account. But the nice thing about a health savings account is you can, if you put money into your health savings account, if it's going through your paycheck, so if it's either your employer's contributing to your health savings account or you've agreed on a payroll deduction to go into your health savings account, it reduces your taxable income. So your W-2 income is going to be smaller, but it's also avoids Social Security and Medicare tax. So you save that 7.5% of taxes on that. You can also contribute on your own to your health savings account, and that will give you an income tax deduction, but you won't get a refund of your Social Security and Medicare taxes. The nice thing, though, about a health savings account is, so far it sounds like kind of like an IRA. You put money into it, you don't pay taxes on it. The really special thing about a health savings account is if you use that money for medical expenses, you also don't pay taxes on it on the way out. So it completely escapes taxes.
Is it still considered a deduction?
It won't be a deductible medical expense because that's considered a reimbursement.
Okay.
But you can use your health savings account for anything that would be a deductible medical expense.
Okay.
So that's one reason, even if you never see a customer with itemized deductions, to have an idea of what is a deductible medical expense, because they could reimburse themselves for that. So if you have a health savings account and then let's say you're in an accident, maybe you trip on the sidewalk or something, nobody's liable, so there's no lawsuit or anything involved for insurance. So you twist your ankle, you have some medical expenses there, so you pay the doctors out of your health savings account, and then you go to physical therapy for a few months. You can also reimburse yourself for the 22 cents a mile that go to and from the physical therapist, because that would be a deductible medical expense. You also can't deduct, I said you can't deduct medical expenses that are reimbursed or that you reasonably expect to be reimbursed. So if you are, let's say you're in a motor vehicle accident and you end up with a lot of medical expenses, and then you sue the person who caused the accident, you can still deduct your medical expenses in the year that you incurred them or paid them. But if you eventually recover on a lawsuit, so all your medical expenses are covered in a future year, normally personal injury settlements are not taxable income, but in this case it would be, because you need to go back and reverse a deduction that you took in a prior year, and the opposite of a deduction is income. So that's what that general rule for recoveries that we talked about in chapter 4 was about. So if you took a deduction for something, but in a later year you need to undo that deduction, undoing a deduction is the same thing as income. If I have personal injury, I have $100,000 in medical expenses, and I find a lawyer going to sue the guy who hit me on the street, I can deduct $100,000, whatever medical expenses are, which I'm also going to reduce that, remember, by 7.5% of my adjusted gross income. And let's say my adjusted gross income is only $50,000. So that means my medical expense deduction is so high that it wipes out all my income. When I recover that $100,000 through that lawsuit, I don't have to count the whole $100,000 as income. I don't have to count the part that I got a benefit for. So I got the benefit of reducing my income from $50,000 to zero. If I undo that deduction, my income goes back up to $50,000 in this past year. So then I have to count $50,000 in income this year. It's not considered reimbursement if you are paid for permanent loss, such as loss of limb, or for loss of earnings. So the rule that says personal injuries, lawsuits, and settlements are not taxable income, even if, and it's common that your lawsuit's going to include, I'm a tax preparer and you crushed my hands and now I can't type, I can't do my job anymore. This is how much I earn per year that I'm not going to be able to earn, so I'm going to sue them for that too, as well as the reconstructive surgery and all that. But that's not going to be taxable income.